Our next guest says for the last several months, he's been popping what he thinks are parasites in his mouth. Take a look.
Hi, doctors. After returning from a trip to Hawaii, I've been experiencing some pretty horrendous symptoms: headaches, nausea, blurred vision, fever, and I've also had lesions appear in my mouth and push weird substances into my mouth whenever I eat food. I've been to several doctors, but they haven't been able to diagnose what I have. So all in all, it's been a really stressful and terrible experience. So doctors, can you help me figure this out, please?
Joining Dr. Batra and I now via Zoom to tell us about his medical mystery is 21-year-old college student Aidan. Welcome to the show, Aidan.
Thank you. Thank you all for having me on. It's a pleasure to be here.
Well, it looks like you were having a good time in Hawaii. You come back and then things went a little bit sour.
Little haywire. It was been about 3.5 months. And I came back from a trip from Hawaii and woke up one morning to my lip swollen to an almost unfathomable degree. It looked like I had a stroke. So that was my first, because it was so big that it sort of made the other side of my face look droopy. So I went into the ER. They said it wasn't a stroke, probably an infection, and gave me antibiotics. Thinking I had that settled, I went home and the symptoms continued to worsen. Everything slowly continued to progressively get worse. And then one night when I was watching a show called JoJo's Bizarre Adventure, funny because when I went to click next episode, I noticed something bizarre coming out of my hand, which was almost string-like coming from underneath my fingernail. And that's when I went to a specialist and my primary physician and tried to get it sorted out, but so far no luck.
Aidan, tell us, how are you doing today?
Today, unfortunately, the symptoms have only proceeded to get worse. I have pretty consistent nausea, as well as occasional joint pain, diarrhea, and blurred vision. And on top of that, I can't really eat, one of my favorite pastimes, because anytime I eat, the lesions in my mouth push this weird white substance out, and it seems to cling on to foods that are super sugary. Another thing I love. So my doctors have proposed that it could be a parasite, it could be some sort of infection, it could be some sort of psychological trick my mind's playing on me combined with some sort of illness. There's a lot of things, and my symptoms, like the nausea and the headaches, have only proceeded to get worse.
Got you. All right, Dr. Batra, we need to bring you in. We want to collaborate as the good docs that we are, try to help Aidan as much as we possibly can. So let me start and ask you, Dr. Batra, have you ever seen a patient with these same type of symptoms as Aidan is talking about?
This constellation of symptoms is pretty rare. And to your point, Aidan, sometimes because it's complicated and it's an unusual combination of symptoms, this set of symptoms ends up in a more specialized center, like a university level clinic. We used to have a clinic when I was a resident at Stanford that we saw some patients like this, but it is unusual and very rare.